My buddy, Dr. Max Gullhane in Australia, went to El Salvador to see Dr. Jack Cruz at an event and came away with some really incredible information around medical freedom and how things are being established down there. And then we dive into more of the quantum approach, how to piece together some incredible minds that have big pieces that we can apply. So enjoy this conversation with one of my dear friends. Dr. Max Gullhane, you're one of my favorite people, brother. I've thoroughly enjoyed following along with the work that you put out. Amazing podcast, amazing YouTube channel, and then doing just amazing work in general. So thanks for jumping on here again with me. I'm excited to catch up. What's exciting and what's new?
Hey, Logan. Yeah, good to talk to you again, mate. And yeah, there's a lot of happening. Thanks for the kind introduction. I just got back recently from El Salvador, and we were talking a bit offline about it, but there was a pretty exciting health summit that was hosted in this country, in El Salvador, and one of the hosts, or one of the main speakers, was a mutual podcast guest of both of us, which is Dr. Jack Kruse. And the event was really bringing together the theme of decentralization, not as it applies to health particularly, but also in a range of other ways. And essentially what Dr. Kruse announced in his speech at that health conference, under the shade of the Santa Ana volcano. I think there's 9 volcanoes in El Salvador, and this was one of them. And it was a little bit of a surreal moment because the clouds had come in. So this whole outdoor area that this conference was being held at was shrouded in clouds. The visibility was down to, I don't know, maybe 20 meters, 25 meters. And, Dr. Jack Kruse, as we're in this movement of grounding and obviously being, acting what we're advocating for. So he's standing in bare feet and a pair of shorts, and his tuxedo, his white tuxedo, because we were wearing white for this Age of Light event. And he essentially announced a pretty groundbreaking an amendment. He actually he's written a constitutional amendment to basically be incorporated into law in El Salvador, the Central American Republic. And the purpose of this amendment is to enshrine protection for patients, and in a way that no other country or no other jurisdiction has ever solidified and put into words and into law. So, for a bit of a background for your listeners who aren't familiar with what's happening in El Salvador, it was essentially, it announced a law basically 3 years ago, a bit over 3 years ago, that permitted Bitcoin to be used as legal tender in that country. And this was following the election of a young president. And prior to the election of President Nayib Bukele, the country was mired in political instability, in gangland crime, in just a very quite an inhospitable place. And consequences of that included that it was one of the poorest countries in Central America. It had lots of people were migrating and attempting to gain work and refuge in America, in the USA. So it had a refugee kind of a diaspora, and it simply was very economically challenged. And part of that legacy was the fact that they'd had failed currencies and they were on a US dollar. They didn't have their own currency. So what Bukele did is he brought in Bitcoin to be used alongside the US dollar as a legal tender. And that act was kind of just one of the acts that this president did to kind of turn his country around. And one of the other things that he did is essentially rounded up all the gang members and put them in jail. So it's transformed the country into one of the most dangerous in Central America and now it's the safest. So it is safer than than Uruguay. It's safer than Puerto Rico. It's safer than Costa Rica. It's safer than Chile. So it's absolutely remarkable what this gentleman has done for his country, and he was recently re-elected. But he's essentially bringing in his intent in transforming the country from and making it a leader, making it a Central American Singapore or Hong Kong, and an area of true freedom and innovation. So what he so Dr. Jack Kruse, who as many of listeners know, is one of the pioneers in quantum biology as that applies to human health and health optimization. So he has basically had written this constitutional amendment that essentially is preventing the incursion into the patient-doctor relationship. And what that looks like, and it's a little bit different in the US compared to in Australia, but what particularly has happened over the past 4 years is that we as doctors have had I would say the privilege that is normally associated with our profession to be able to treat our patients in the way that we medically see fit. That ability was essentially taken away. And it's it's a quagmire of a topic, so we won't necessarily go into that. But the point is, it's exciting what is looking like to be incorporated into law in El Salvador, because there'll be a raft of protections that mean that if your doctor decides that there's a therapy that you are going to benefit from, and he gives you the full, or you give him the full informed consent, and that discussion happens, then any kind of treatment that might involve things like generic medications, that it might involve treatments that are non-conventional by conventional mainstream treatment standards, that all becomes a possibility. Research and rapid research becomes a possibility. So it's all it's very exciting, because the implications is that this is going to be possibly going to be a place that cutting edge medicine gets done, and that is incredibly exciting to me and to other practitioners who are really kind of wanting to push the boundary in terms of what is possible for our patients. And students of history will learn about, if you go back in time and you learn about Ignaz Semmelweis. He was I like to use his example because he really illustrates this problem of what it is to, or the struggle that it is to bring a new paradigm of thought into medicine. And he was essentially outcast because he was proposing that cadaverous dissection, so cutting up dead bodies and then delivering babies, was a bad idea. And he'd worked out by deduction and observation that that if you conducted a cadaverous dissection and didn't wash your hands, then the probability that you were going to induce puerperal sepsis or an sepsis around the time of birth was massively increased. So he was telling his colleagues that, hey, gentlemen, we need to wash our hands before we do this kind of operation, this obstetric delivery. And he got laughed out the room, and completely derided, and became a pariah in his industry. And I believe he died in an insane asylum as a mental health patient. But that illustrates the and obviously he was vindicated pretty soon after that with Louis Pasteur's work and discovery that there was infectious organisms that were kind of responsible for the problem. So Semmelweis, his story illustrates how difficult it is to change an entrenched paradigm. And it's exciting that nowadays, in this internet connected world, and with technology moving so quickly, and when you pair that with what things like El Salvador are proposing, then we can potentially break down those barriers to getting patients the most cutting edge care that is unrestrained by roadblocks. And the key point here is we're not getting rid of safeguards and protections, and that is as important as ever. But it's really the hurdles, or the potentially the unnecessary hurdles to innovative care that I think is going to be that is going to be removed. So that was the highlight of this event in El Salvador, and it's very exciting to see a lot of people coming together. And this theme of decentralization is in health, but also in money and all these other facets of society are really finding a nucleus in the Central American country.
It's cool. Loved seeing y'all's pictures. I know Tristan and Anjan were down there too, so I know that was awesome to get to see a lot of like-minded people. I think it's still fascinating to me that our generation seems to really be just forging ahead, regardless of anything. So give me a little bit of an example of maybe where what Dr. Kruse is proposing in his constitutional amendment, like a more specific example of what wouldn't fall under that, with whether it's Australia or the United States.
Yeah, look, there's so one example would be say a mandate. So if you, for whatever reason, your patient wasn't suitable for that, or in your medical opinion, that a potential a mandated medicine would have greater harm, risk than benefit for your patient, then there'd be no reason why that should be enforced or compulsory for that patient. So that is one of the kind of clear examples. Another one is the use of repurposed medication, and over the past 4 years there was multiple kind of opportunities and actual evidence that a range of medications that have been previously discovered and are off patent would have efficacy, would have benefit in, say, certain respiratory viruses. And that process of prescription and use of those medications in patients was blocked. And it was blocked by centralized entities in this whole medical and a kind of pharmaceutical industry. So the implication of one of this bill would be to give that discretion back to the doctor. So the doctor can go back, he can read the product information of these particular drugs. He can do his own research into the side effect profile, into the dosing schedule. He can talk to cutting edge clinicians in other parts of the world, understand the potential dosing of a novel drug, of a repurposed drug for a novel indication, and that process can happen in real time, quickly, as potentially a new disease is manifesting, and again with full informed consent for the patient. Okay, we're going to try this drug. It's been used in this indication safely for 25, 35 years. It's on the list of essential drugs for all countries. Let's give it a go. The downsides are limited. The potential benefits are quite high. That conversation can happen with the patient and the doctor, and it doesn't matter what any kind of body's opinion is about that. El Salvador's would enshrine protection for that decision that your doctor has made for you. So awesome. I hope that makes sense.
Yeah, no, I think that makes perfect sense. So basically, vaccines would not be able to be mandated, right? Or any sort of quote unquote treatment could not be mandated by the government outside of a doctor-patient relationship. And then, for example, I mean, it was the studies were there, right? Hydroxychloroquine, ivermectin, whatever, as potential for exactly what you're saying as a repurposed drug that is. I mean, it's everywhere, right? Like it's not new, novel, anything. The virus was. Methylene blue is another one that gets looked at like you're crazy when you mention it. So I think that's absolutely incredible. But to play devil's advocate here, what's the pushback? Like who's fighting that? Like who is saying that a doctor and a patient shouldn't be able to do what they believe is in the best interest of a patient.
Yeah, and look, that gets into some murky territory, but essentially there's financial interests and economic interests that are want to protect the essential power to enforce the use of novel antivirals, novel medications, novel chemotherapeutics, novel anti biologic and antibody therapies. There's no money to be made in a generic drug, so that that gives you kind of all the answer that you really need. Is if there's no money to be made, then there's going to be ways that those generic or those off label but repurposed medications are going to be discouraged from being used. No matter, even if there's solid scientific evidence of benefit and efficacy.
I just wrapped up, kind of took a deep dive on parasites. And of course, all the antiparasitics came up in that topic too. Fenbendazole being one of them. And so it just blows my mind that we aren't able to do things that have shown so much efficacy. So I think that that's such a much needed thing. I think, medical freedom is something that we've got to have, like just as a fundamental constitutional right. I just don't know that, as far as, the United States, the founding fathers ever thought that type of tyranny was going to exist, which obviously it does. But another one, and this is why I love talking to you and following along with what you do, is the food system and agriculture. Like the same exact problems are in both of those industries or sectors as well. So what's going on in El Salvador as far as that, addressing those, or is anything happening just yet?
Yeah, look, that's a great question. And so there was actually the beef industry, and maybe I'll start there because I've got a bit of a brief understanding of what's going on. Prior to maybe the past 3 years, most of the beef was coming in through Nicaragua and other kind of Central American countries. It was processed, bleached, probably full of hormones and other undesirable contaminants in the food supply. There was a company started by an Australian called Owen Guillem, and it was called Beef Back Better, and his operation was to source fully grass-fed beef from a local ranch that was using holistic grazing practices and a chemical-free approach, and then simply buy that beast, hang it for the appropriate time, and then supply that, but mostly to the to Bitcoin expats but now to a growing El Salvadoran middle class. So Salvadoran middle class, we don't say L when you describe it, the people apparently. And so what that has meant is that people now have access to a really high quality beef product. He's since moved on, but there's a fellow Aussie, James, who's now running the company. So that's kind of a step in the right direction in terms of providing access to food. But that's only kind of one small operation, and there's a lot of Latin America, and the population itself is consumes a large amount of refined foods, a large amount of soft drinks and soda, a large amount of oil, like cooking oils and refined seed oils and carbohydrates. So there's work to be done in terms of kind of helping people move into a more holistic, healthy, well-rounded type of diet and locally sourced diet. But there's movement happening, and I had a chat to the brother of the president, and they have an intent to really turn things around. They want to generate a local economy in coconuts and start promoting coconut oil as a replacement for seed oils. And they have all the power to enforce something like a seed oil ban. That was something that potentially could happen. But really, they want to foster a local industry before they kind of do anything like that. But it just shows that there's so much intent from this government they really care about their people. I mean, that was the overwhelming impression that I got. And the president did a recorded speech at the event, and the overwhelming takeaway that I got is this is someone who actually cares about the health of his people, and isn't beholden to other interests that are kind of getting in the way, or selling something else that he's not selling his people out. He's really cares about them. So it's a small country. It's not a large country, but I mean, just like anywhere, the possibility for more decentralized, smaller farms supplying fully grass-fed beef, I think it's enormous, and it's going to take people, and it's going to take the private sector to really take that off, and they're really welcoming to entrepreneurs and other people who want to do things like this. So there's the sky's the limit really in El Salvador.
Is it something to
I'm
where
not
you?
paid. I just want to make that point. I'm not obviously have no financial interest. They're not paying me to say that. I'm just you and I are both passionate about this concept of decentralization, and it really is it's really manifesting in this place. So it's hard to not be passionate about that when in maybe in our countries and other Western countries, it's such a battle to make progress on these fronts, but it seems like there's this country now who are welcoming innovation in these areas with open arms.
No, absolutely. I definitely want to get down there and experience it, but you just can see how Dr. Cruz talks about it. Everything that's come out of there just seems so positive. It's something that just like a beacon of hope for all of us, because I think for the most part, we can all feel that something's off in our countries, whether it's yours or mine, or the United Kingdom. I think a lot of the world is just not right now. So it just to have hope, it's beautiful. Listen to the Herd Quitter. One of my buddies, Jared Lumen's got the Herd Quitter podcast, and Alan Savory was on there. And I think back as you were going through the food system with that, he said, I just need one country that wants to commit to a holistic approach of agriculture. And it was so beautiful. And I think, man, getting the Savory Institute in El Salvador would be possibly a absolute game changer based on just trying to do something positive. When Dr. Cruz was on, I asked him about the food system. I was meaning more about the food system, right? Like I own a farmer's market. I'm actively involved in the local food system. And I think that he took that question to mean how do we use food to fight cancer instead of the food system. And so what is your thoughts on that? On how do we build out the food system, right? How do we build out the food system, whether it's Australia, El Salvador, here in Arkansas, in a way that is conducive to what you have seen with quantum biology? And I say that to reinforce, Cruz will go after you over food, right? Like it's his thing. Don't say food's the end all be all. That's not it. It's sixth on my list, but seriously, I think it's of the utmost importance, the food system, and we got to get that right.
Yeah, I think the essence of it is promoting decentralization as much as we can, and this quantum biology and circadian biology relies on this decentralized system of nature and the light and dark cycle of the sun and the moon, and our biology is in tuned to that is a decentralized network, and Dr. Jack is the first person to kind of really make that point. So what we need is a decentralized food system that again has no intervention by food companies, by dietary guidelines that are simply looking after the interests of things like the religious ideologies of the Seventh-day Adventists and other food companies. So we really need to decentralize as much as possible. The solution in my mind, or the barrier that I see here in Australia, I'm not sure if it's similar in Arkansas, is regulation, and the fact that for a small grower to set up a direct-to-consumer paddock-to-plate operation, there's just so many barriers in the way. And one of the most important from a regulation point of view is processing, and the fact that you can have a farm that's growing the most healthiest cows, but if you have to truck them 400 kilometers to the local abattoir before you can kill them and process them, then that's a massive headache. One, you don't want to do that because you respect your animals and you don't want them to suffer. And two, it's costly. So there's a there's one operation in Australia that has a mobile type abattoir, which is a B double truck that's set up for essentially processing animals on farm, and I think they can do about 35 to 40 kind of bodies a day, but that's only going to be a fraction of what we need to feed a population this healthy diet. So El Salvador is potentially one place where they can encourage healthy regulation. And I talked to Owen Guillem about this when I interviewed him last year, is that yes, we need food safety, some degree of food safety standards in place. We don't want people getting sick. We don't want food, animal waste and carcasses being dumped, in public places. Obviously, I feel like that's basic. That goes without saying. But we also don't need excessive regulation. And I'm thinking, because I met with some farmers recently over the past 2 weeks, is that if we just simply had a regulation that allowed home kill, so you could kill the animal, because currently in Australia you can kill an animal on site, a beast, a cow, but that meat can only be for domestic consumption. It can't be sold. So a simple workaround would be you can change these regulations so that you can do a home kill, but as long as it's processed by a licensed butcher, then that meat should be able to be sold to people, and that would reduce these barriers of entry for small scale local producers to get into the paddock to plate operation. Because a lot of farmers, they love their cattle, they love farming, they don't want to jump through all the regulatory hoops, and that is really takes the wind out of their sails, and really concentrates power in the industrial kind of model. And I know that's in America as well, because Texas Slim, who we both interviewed now, has said the same thing. So I think being somewhere like El Salvador, who are so bought in, and they have, I discussed regenerative farming with the president's brother. They're interested in this. They are forward thinking. So working with say an administration like that, who is so open minded to making this work, could be a great first step. And especially for something as you mentioned, Alan Savory's work would go down very well there. I think the Nguni cattle, these African Sanga cattle, would be perfect for somewhere like El Salvador that's dry and wet. Alternatively, and you need a robust animal. That the Owen and Beefback Bet are using Brahman crosses, but a lot of these Sanga cattle are essentially just more robust, more fertile, hardier, smaller framed Brahman cattle. So there's so much to be done, but really being in an area where there's not excessive regulation is how we how we scale this, how we promote decentralization. You can have raw milk in El Salvador. There isn't the barriers that there are in here in Australia and elsewhere to access raw milk. So things have to change, and it's great to see that's a place where they're so welcoming to innovation.
Yeah, that's. I agree with you. The regulations are they're stranglehold the local movement. I mean, that is a big part of it. And the raw milk thing, that is something I've taken a little bit of a dive on lately, and it's insane. What's your stance on that as a medical professional, and what's your stance on the raw milk and raw dairy?
Yeah, look, it's reminiscent of these the recommendations against raw fish in pregnancy. And if you actually run the numbers and you look at the rates of foodborne illness and you kind of compare them, especially with some of these lettuces and greens, or the outbreaks in America of listeria were related to Brussels sprouts or alfalfa sprouts from a industrial production facility. So I think the problem of food safety lies in the distance and the disconnect between the producer and the consumer. When that distance is shrunk, you're going to know pretty quickly if Farmer Joe is using poor hygiene habits. Like that can be worked out at a community level pretty quickly. So these consumer protections and these laws get put in place as a result of a system where 20 milk trucks all put their milk into one big vat, and it all
Right.
gets mixed up and then sent out to supermarkets. But if there could be allowances for this small scale production and consumption, and just reasonable common sense laws and regulations, then that transparency is going to help self-regulate and the industry. I mean, Instagram and Twitter and Facebook, you're going to know pretty quickly if there's a dodgy operator at play.
Sure.
And the amount, I just think there's unnecessary amount of intervention, and we call it a nanny state here in Australia. There's an unnecessary nanny statism when it's going to something like that, and especially when you consider the health benefits that we're potentially trading up by enforcing these rules. So the landscape's changed, and the laws have not kept in touch or in pace with them, in my opinion.
I think you're spot on again, my friend. To switch gears just a little bit, one thing that I've absolutely just loved is when we interview the same person, because you have such a different perspective than I do, and I get so much more out of it. So with that said, I wanted your take on the body of work collectively of, say, Dr. Cruz, Morley Robbins, and then Dr. Laszlo Boros. I think the three are absolutely brilliant. I think they have got when you put that whole picture together, something that is beautiful, and it makes a lot of sense. So how do you rationalize going through all of their similarities or maybe even differences, and what's your take on the three collectively?
Yeah, that's a very deep question. So I agree with you. I think from a theoretical point of view, they are, and practical, but they are some of the most important leaders in the world. So I guess each one of them is covering at health from a different angle. So Laszlo Boros, for the listeners, is a Hungarian researcher, pioneer, and expert in deuteronomics, or the effect of deuterium in human health. So I think his views, and especially when he's a good partner with Dr. Gabor Szomlai, who's using deuterium depletion strategies for cancer. I think that is incredibly important. That is, the deuterium story explains, in my mind, the food story. I think food can be understood in the context of deuterium, and that means cancer, that means diabetes, metabolic disease, and these essentially people consuming high foods or food products because they're ultra processed, rich in deuterium, being disconnected from an environment where they can naturally deuterium deplete themselves. That's a critical driver of chronic disease, and in addition to the light stuff. So I think the work that Dr. Boros is doing is incredibly important, and really explanatory from a dietary point of view. Morley Robbins is, again, a gentleman who's incredibly intelligent, has done a whole bunch of work, and his protocol is efficacious. It obviously is. I'm less familiar with his work, and I'm less inclined to push a regime that necessitates the ongoing consumption of supplements. I think that supplements in certain situations, for certain people, certain contexts, are part of getting people from dying or surviving back up to thriving. But I kind of reject the long-term use of necessity for using supplement, because it can turn into, and this is what the functional medicine space in the US has turned into, it can just turn into another version of allopathic medicine, where you get a lifelong prescription. It's not of a statin, but it's of X, Y, and Z supplement. So I think that what Morley's doing is incredibly important, and speaks to a different type of person, and that process of acute healing can be done in a lot of different ways. A carnivore diet is a very effective way. Maybe in certain situations, if people have been in this state of high calorie malnutrition from eating an ultra processed diet, like especially in the US, even more so than Australia, then they need to perhaps. It's just one way of doing it, but I just don't think that we shouldn't be relying on supplements long term. And then Cruz, I personally think that he sees the most parts of this picture. I think his depth of knowledge and his kind of disciplinary approach is unparalleled. I think there's no one even close to him really, who's thought about this in all these different ways, because it's common to be able to drill down into a topic and become a subject matter expert in a very narrow way, and that is what most subspecialists in medicine, whether they're oncologists or cardiologists, electrophysiologists, immunologists, that's what they're good at, and they're smart. But that's not really smart in my book if you can't see the full picture. So in terms of seeing the full picture, I think Dr. Kruse is closest to the mark in terms of incorporating the light, incorporating deuterium, incorporating the physics and the biophysics and the quantum biology, all in one place. So the intellectual pioneering work, I think I agree with you. I think is being done by gentlemen like Dr. Boros and Dr. Cruz, and I guess it's up to people like it's like me to help translate that, and you as well with your podcast to try and translate their work into practical application. But these gentlemen are basically pillars of this decentralized health movement. And what is decentralized health? What is decentralized medicine? I think it's an objective. It's an ability or a look at the scientific research to come up with a solution or a treatment protocol or an opinion, medical opinion, that hasn't been funneled through a centralized body and therefore had its opinion modified or manipulated by a financial conflict of interest. So the gentlemen that you mentioned, they are some of the stalwarts of this movement, because they've all spent years. Boros has spent years on lab-based research on deuterium, and Morley Robbins has done the same, investigating the role of minerals, and Cruz he has himself. So they've done the work, and they've come to conclusions that are differing from decentralized approaches. And what that means is Dr. Boros is advocating for a really high-fat carnivore diet. He recommends eating really low. He recommends eating animal fats, like grass-fed animal fats, because they're going to be the lowest deuterium diet. Obviously, the light, Dr. Cruz is recommending all these light protocols that no one else prior to him had really advocated for. And again, Morley makes money off supplements, but they're effective in certain situations, and it is not. It's not like a proprietary drug. So, yeah, they're the pillars of this some of the pillars of the decentralized health movement, and yeah, they're doing amazing work.
With kind of the, let's just say controversy of Dr. Cruz, right? Like, so there's a lot of people that he just simply rubs the wrong way, and he's not afraid to fight with somebody, right? Or maybe I don't know. Sometimes he can just be pretty rough on people. So what is the opportunity there? How do you see, whether it's Tristan, you, me, y'all are definitely much closer to Dr. Cruz than I am, but on getting such an important message with or maybe without a filter, how do we do that? And is that even important in your opinion?
So I think a message has to be carried by different people. We're all just simply messengers of the message itself, and Dr. Cruz himself is simply a synthesizer of people that went before him, just like we are doing the same thing. So no one necessarily has the copyright on the ideas. They're simply packaging these ideas in a way that makes sense for them. But the great thing is that everyone can read. Different people read the same material, and based on their understanding, their training, their background, they're going to have a slightly different understanding and way to present the same information. So what that means is that you say what you will about Dr. Cruz's delivery method, and he has his reasons for using that. That's just him. That's him, and that works for him. But there's no reason why everyone needs to present the information in the same way. And in fact, we want people to present it in different ways. And you mentioned earlier that it's helpful when we interview the same person. I've definitely found the same thing, because it's just fantastic to hear another smart person explain a concept in a completely different way. And that, I think, is how concepts really get hammered into the collective conscious, when you have smart people talking about them on podcasts in different ways. And the number of times where things have clicked when you've heard it explained slightly differently by someone else is so important. It's critical. So it takes everyone, and everyone has a role. Everyone has a special ability, and we really need to encourage everyone. And Cruz does this, is to read the primary material, read these books, read all this literature, and find a way to explain it in your way. And I'm right now I'm doing a course, doing Solar Callus course, which is explaining how to get sun exposure in a kind of ancestrally appropriate way to optimize health. And that is going to be slightly different to the way that Dr. Jack presented that in one of his blog posts. So it's going to take everyone, and I think that's the beauty of this decentralized movement.
Well, I've thoroughly enjoyed getting to just, be a part of it, do my small part in bringing together just incredible people and picking their brain, because Lord, there's a lot, and then you get all the conflicting opinions, and you'll have two people that are absolutely brilliant, and they will absolutely fight to the death at opposing ideas, right? And it's like, how do you even make heads and tails out of this? And so it just kind of makes me sad, though, when we get the ego and we shut people down, because there's a lot of good people that need to hear the message, and they're just not hearing it because feelings and ego and all that. And so I appreciate the way that you go about it. You're very kind and professional in your delivery, regardless of who you're talking to. And so, man, I'm happy and excited to be an ally in this movement with you, my friend.
Yeah, thanks, Logan. That's very kind words. I appreciate it. And really, for me, it's the ego has to be put aside, because this is about our patients and people. There's no room for ego. There's no room for important or hurt feelings or rudeness. I mean, it needs to be put aside, because we need to get to the truth so we can deliver our patients the best care. Absolutely. And I mean, that's the truth. Science has been historically rife with people who got sore egos, and it's set back. It can set back discoveries. It can set back collaboration, and that's really not good enough. And as much as I can, I try and put that aside, because I'm on a mission. We're on the same mission, and that is to help people and to deliver a better way of doing this and a better way of helping and healing people, because we know how sick people are. We know how much sicker they're going to get if the current trajectory of excessive blue light, of ultra processed foods, of non-native EMFs, if this continues, then the nursing homes are going to be full with people age 50. Yeah. But it's a downtrend in health compared to our previous generation. So we've got a massive job ahead of us, and I really think, as much as I put the ego aside, because we just don't have time for that that at all.
I love it. Yeah, I'm reminded when I asked you a question on a controversial topic, and you're like, man, it just doesn't matter. It's just we don't have time to go with the back and forth. You get into all the tribalism of diets or whatever. I mean, then we get religion or politics. You name it. It's rampant everywhere. I wasn't picking on anybody individually. It's just like we just gotta get better and help people. So. Where can people go to find out more about your course? That's so exciting, podcast and everything you're doing.
Yeah, and maybe I'll bring it back to El Salvador as it relates to what we're just talking about, and the possible implication of this constitutional amendment that Dr. Cruz has written is that there's essentially going to be a UFC cage fight of ideas, and what that looks like is that. The vision is that they're going to bring the most innovative practitioners to to El Salvador and allow them to use methods again that are unconventional, not mainstream, innovative, and again with fully informed consent. And the way to understand who wins this, this cage fight of ideas is your peers. So doctors, not anyone else, but doctors, after 2 years, are going to sit down, and if you decided to treat your patient with licorice sticks, and their cancer that was stage 1 has now metastasized to stage 4, and they're palliated, then you that doctor or that practitioner is going to be on the line, and they're you're going to get fined. And I think the fine was going to start at the price of Bitcoin when the law gets passed. So that's when it starts. So and I really want to make this point is because the flip side of responsibility and the flip side of rights, and the right to treat your patient as you see fit, is responsibility. And if someone is practicing in a way that is causing people harm or is not helping them heal, he gave another example of very, very famous prominent doctor in this space who charges $125,000 or $150,000 US, and if that patient hasn't gotten better in a year and they've charged that amount of money, you're not going to be able to practice in El Salvador, because you're not looking after your you're not doing this properly, you're not doing this in the spirit of what we're trying to achieve. So that's an interesting point, and I think it's going to be one of the best ways to self-regulate innovative medicine, is that doctors themselves need to be the judges of their peers, because everyone, and this is the medical field, is everyone respects each other's discretion, and everyone respects each other's license and discretion to treat the patient as they see fit. But every once in a while, you'll hear a story of a surgeon who's doing a couple more knee replacements than he needs to, or who is billing. Maybe this cardiologist is stenting a lot more than his peers, and the patient doesn't know that. The patient wouldn't know that, and the way that the regulatory regulation is set up is, how would they know that? There's such a asymmetry of knowledge between the practitioner and the patient that there needs to be a very important and curated way of policing this, and it's self-policing. So I just wanted to add that is an incredibly interesting feature of what we started talking about at the beginning of the podcast. So, but we'll see what happens, because this has been said. It's been said recently, but we also need to see it, how it gets implemented in reality. But yeah, so thanks for having me on, Logan. It's always a pleasure to speak with you. And my podcast is the Regenerative Health Podcast. My course, Solar Callus, is almost released. It's in the progress of being released. So I've actually still got a pre-sale offer on that. If any of your listeners are interested in basically building the skills to get build sunlight for health, and we know that greater UV exposure and greater sunlight exposure is associated with less cancer, less cancer diagnosis, and less cardiovascular disease, less cancer mortality, and less all-cause death. So I think it's a key skill for people to learn, and it's, again, pretty counter-narrative at the moment. And the other exciting thing that we're about to do, and maybe you have some Australian listeners, if they live in Melbourne, on the 21st, we've got an event in Melbourne. So Dr. Anthony Chafee is going to be speaking. I'm going to be speaking. Dr. Pran Yoganathan, who's a gastroenterologist and holistic gut health expert, and Dr. Jalal Khan, who's quantum medicine and holistic dentist. Natalie West, who's using a carnivore diet with her psychotherapy patients with amazing results, and Charlie Arnott, who's one of Australia's pioneering holistic grazing and regenerative farmers. So there's going to be 6 of us. We've also got Kira Lee, and she's going to do we can do a El Salvador Q&A. We've got a 2-hour lunch break. We've got exhibitors, regenerative farmers. We've got a local brand that harvests wild caught venison and supplies that. We've got metabolic health doctors and essentially decentralized doctors. They're also going to be exhibiting. And we've got a man called Jimmy Brisket, who is going to be cooking a barbecue for everyone. So it's going to be an amazing event. if anyone is interested in Melbourne on the 21st, you can follow my link to get info. But that's called Regenerate, and that is the second event that we're doing, and it's a movement that I'm interested in helping gather steam to give a platform for these decentralized voices in health, because people need this information, and if they're not getting it from any other source, then we need to be that source that they can make informed decisions about their own lifestyle and their own health. So yeah, thanks again. Thanks very much, Logan. Yeah, great to connect again.
Always enjoy, man. I would love to be at that conference. It sounds like it's going to be an absolute blast. Some of my favorite people, for sure. Well, man, I appreciate you so much, Max, and I will keep you posted.
Fantastic. Thanks, man. Have a great day.
Thank you for joining us on Sowing Prosperity. Be sure to follow along across the social media platforms, including YouTube, and be sure to go to sowingprosperity.com.